As we have every day for the last 3 weeks, our focus is on the coronavirus international pandemic. As of today, folks, there are 265,506 confirmed cases of COVID-19 in the United States and 3 U.S. territories. At least 6,786 patients have died with the virus. 11,983 patients have recovered from the virus. Now, those deaths, that's an increase of 1,074 people since yesterday at this time. Man, more than 1 million people have died worldwide from a result of coronavirus. It is clear that we're at war with this disease, and without proper leadership, we're losing. Now, just a few moments ago at the White House news conference, Donald Trump announced that the CDC are now going to require asking all Americans to wear non-surgical mask or to wear a face mask in public. That was announced just moments ago by the Surgeon General. Anthony, go to my iPad so I can play that.
Great question that you ask. It's a fair question that you ask. I want to unpack the evolution of our guidance on masks because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms. This means that the virus can spread between people interacting in close proximity. For example, coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. These include places like grocery stores and pharmacies. We especially recommend this in areas of significant community-based transmission.
That is the decision, again, shortly from the White House. Joining us right now to talk about this response, some might say greatly confusing, is retired Army General Russel Honore. Glad to have you back on the show, General Honore.
Hello, Roland. Good to be with you.
Yesterday, it was interesting. For the first time, Jared Kushner came out to address the public, and he made some comments that many people found to be pretty confusing, suggesting that somehow that he needed to be able to come in and knock down these walls to be able to get government to work with each other in the private sector, and how Donald Trump asked him to step in. Then he also made this crazy comment by stating that the federal stockpile wasn't for the purpose of the states, which is actually on the government website. They went and changed it after he made the comment. What did you make of what the hell he was talking about?
That boy didn't know what the hell he was talking about. He's making stuff up. And then overnight, the crime was to go change the website to try and match what he said. So there's a bunch of people complicit in covering him saying something, didn't know what the hell he was talking about. So the guy made a mistake. We can make a mistake and misquote something. But the purpose of the national stockpile, you can go back to the National Defense Authorization Act, to the money Congress passed every year for the government. It funds the national stockpile for the use of the federal government as needed in supporting anything that happened in the world or anything that happened here in the United States, where we need that stock that it's on hands. He had no idea what the hell he's talking about. But the sad thing, they went change the website to match his words. These people are unscrupulous. They are unbelievable.
And Daniel Dale, who is a reporter who basically, even when he was working in Canada, tracks the lies, if you will, of Donald Trump. And this is what he posted. This here is the, I'm showing right now the screenshot of the from the website. Anthony, go to my iPad of the Strategic National Stockpile. To all y'all, this was the screenshot from yesterday, people. It says Strategic National Stockpile is the nation's largest supply of life-saving pharmaceuticals and medical supplies for use in a public health emergency severe enough to cause local supplies to run out. When state, local, tribal, and territorial responders request federal assistance to support their response efforts, the stockpile ensures that the right medicines and supplies get to those who need them most during an emergency. Organized for scalable response to a variety of public health threats, this repository contains enough supplies to respond to multiple large-scale emergencies simultaneously. Now, folks, that's what that website said yesterday prior to 5:30 p.m. before yesterday's briefing. This, folks, is what you will now see if you go to that website. The Strategic National Stockpile's role is to supplement state and local supplies during public health emergencies. Many states have products stockpiled as well. The supplies, medicines, and devices for life-saving care contained in the stockpile can be used as a short-term stopgap buffer when the immediate supply of adequate amounts of these materials may not be immediately found. That is unbelievable, that you would literally change the website to match what Jared Kushner said at a news conference when what he said is BS, because what the website initially said is exactly the purpose of the federal stockpile.
Exactly. You know, this is what happened when you bring family and volunteers into the White House. Every principal around the White House have to take an oath. I ever wonder, did Jared and his sister ever take an oath to support and defend the Constitution of the United States? Because they cannot be held accountable for what they say. If the CDC guy or the Surgeon General said that, they could be questioned and said, hey, did you lie to the American people? Did you lie as a commissioned officer who swore an oath to support and defend the Constitution? He'll walk this guy, come make stuff up, then overnight change the website to match his words. This is like a gangster operation, if I've ever seen one. And I don't know what Jared's doing, but he needs to go find something else to keep himself busy, because this is too complex for him to jump in and try to learn this complex system. It took me 37 years to learn it, and he can't walk in and start making stuff up and try to solve this issue in the middle of this disaster, Roland.
And what gets me, General, let's not act as if FEMA has not had to deal with national emergencies before. I mean, you actually have, it's the Federal Emergency Management Agency. Not only that, were you bothered yesterday by that admiral, I believe, who when he said that they are delivering federal equipment to private companies to distribute, as if the federal government doesn't have planes and trucks?
It is the weirdest statement I've ever heard by a commissioned officer. That admiral is the vice director for logistics for the Joint Chiefs of Staff. I've never heard the government participate in something like this. So literally, the air bridge that they've arrived, most of this stuff is coming out of China. They arrange the aircraft to come here. The airplane land, let's say it's in New York. Then they take half of the supplies FEMA take control of. Then they let the private sector have the other half. What kind of deal is that?
And
American government paying twice for this stuff.
Right, and then with the private, what they're doing is they're then turning around. See, the private sector is then turning around and then trying to sell masks to states for $6, $7, $8, $9, $10 and normally cost $1.
and we'll put a brother in jail for selling a cut CD. You know what I mean? What's wrong with this? This makes no sense. Last month, you don't need a mask. This month, yeah, we think you need a mask. It's unbelievable. The truth keeps changing, Roland.
Well, and not only that, first of all, he bristled at the news conference when he was asked, where's Dr. Fauci? And Trump was like, well, sometimes I have him here, sometimes he doesn't. And my deal is we trust Fauci more than we trust you. The thing here that for a lot of people out there who don't understand, and again, I've never been in the military, but trust me, as a journalist, I've covered enough disasters, hurricanes, tornadoes. I've interviewed enough people in the military. Our military is used to moving stuff real fast, real quick, all over the world. This idea that our military, I've had 2 4-star generals on here, Lloyd Austin and Kip Ward. Our military can move faster than give me a break. So these guys are trying to act as if like, oh, no, we've got to have these companies in their truck. They do these things every single day. And no, the problem is that Donald Trump has aligned with the Chamber of Commerce, and these people are making millions and billions from this national emergency, and that's the real deal.
It's called disaster capitalism. It happened after every disaster. Favorite companies get the big contracts. They take the money off the top. Look, Roland, this same FEMA region that's dealing with New York, FEMA Region 2, they have not repaired the houses in Puerto Rico. They have not repaired the houses in St. Croix. And now we're asking them to deal with the hottest spot in America. And they're doing this with an acting FEMA director. What in the hell is going on? But let's talk about this for a minute. Because our people got to know we've survived a lot worse. We got to take care of one another. We got to take care of our elderly and our relatives that have secondary conditions that might get exposed. And we got to make sure none of our preachers are going out there and trying to hold no group service or church on Sunday. We've got to work inside our community and help take care of one another and take care of our people and support the nurses and doctors in our community, regardless of what flavor they are, support them so they can go back and take care of people in the hospital. I think that is what's going to save this, because as I've said before, the only one going to save us is us. And the people are going to have to look out for one another and take care of one another in this time of need. Also,
I think also that people are now seeing the BS that we're hearing. The ABC as well as Rasmussen shows that his approval ratings have dropped, and his handling of this crisis has dropped because, and in fact, I dare say, because he got so excited with that New York Times story over the weekend about the ratings of these news conferences. Since he's taken the news conferences over, he now actually looks worse because the lying, every time he stays up there and lies and then has to get corrected by Fauci or come back, it shows he's incompetent in what he's doing. In general, what it's doing is it's actually putting the nation at risk. I have never seen a commander-in-chief stand in before microphones and say, why do you need so many gowns? Why do these hospitals need so many masks? Why do you need so many ventilators? When in a moment like this, you don't give a damn about, you say, go make 1 million ventilators, and if we only use 500,000, we'll figure out where to store the other 500,000. But you don't nickel and dime America while people are literally dying.
It's a sad case to say that many people will die in the coming days because we don't have ventilators. Many of our doctors and nurses will get sick because they're not properly protected by having the proper PPE. And Roland, we don't have a quick test, but these doctors and nurses need to be checked between shifts so they're not taking this home and they're not bringing it back in the hospital. I'll give you a number. We have one hospital in New Orleans where 16 healthcare workers came up positive. That next day, they isolated another 314 people who had worked with them the day before. That's the danger of not having some quick tests that we can test people who's working to try to save lives, Roland. That's the sad thing.
And we were told, I mean, I sat there and watched it, CVS and Walgreens and Walmart, we were going to be using their parking lots for massive drive-through testing. None of that's happened. We haven't seen it. We wasted, frankly, 2 months when it came to the labs. And so the problem is you don't even have enough labs to now process those tests as well. I mean, but this is what happens when you have incompetent people who are in charge. You have been sounding this alarm. It was glaring, and all the sugarcoating. Oh, we're doing great. We give ourselves a 10. We've been wonderful. We've been phenomenal and awesome. Look, all that pat on the back means nothing when people out here in New York are dying, when the cases are exploding in Mississippi, in Florida, in Louisiana, all these different places. And finally, you're seeing these red state governors finally wake the hell up and have shelter in place. And even with shelter in place, all these people who keep saying that this is going to somehow destroy our economy, you know what actually destroys the economy? Uncertainty as to whether or not I can go out and if I'm going to get sick. So they can they can try to rush through this and get us back circulating. But what kills you is people say, I don't know if I don't want to go to work or go out because I might catch it and might die. That, to me, is the scariest thing if you don't have shelter in place all across the country.
And think about this, Roland. We got a lot of people out there stocking shelves of minimum wage. They are clerks at the stores, minimum wage, and I don't mean $15 minimum wage. A lot of them are working for $8, $9 an hour.
Yep. Exactly.
Why wasn't something included? We need those workers.
Yeah.
You have the best supply chain in the world. If you don't have a delivery system, you can't get there. We need to take our hat off. The minute them are our people, minority people doing these jobs. What happened if they said, I'm not going to risk myself to go out here for $9 an hour?
And what's crazy?
We witness to them, and we see them in the store, we got to thank them, Martin.
And what's crazy is we now know that the coronavirus can actually somehow stay on boxes. And so we also got to make sure that they have been tested because they're the ones who are also touching goods, things along those lines. And here's the last thing, General, the point that you just made. What this coronavirus pandemic has also shown everybody, the people who get overlooked in our society, nurses, teachers, medical professionals, store stockers, all the people who,
truck drivers,
all those people, we need every single one of them. Otherwise, we can't even go to the store and buy goods. Isn't that quite interesting?
Yeah, and we ought to use this time, all of our friends you got coming on, to put some hellified heat on Walmart to pay our people a living wage and with health care. There's no reason why they're not paying people a decent wage with health care, because right now many of those workers have to go on Medicaid and ask the government to take care of them, because Walmart is more worried about profit than they are taking care of their people.